Do you keep using allergy drops only for the itching to come back again? Take a closer look at your eyelashes, because the real cause may be hiding right along your eyelids. When people have itchy eyes, they usually blame allergies. Maybe it is pollen, dust, a pet, makeup, or change in the weather. So they buy an allergy drop, use it for a few days, and expect the problem to disappear. Sometimes it helps, but sometimes the itching returns again and again. If that sounds familiar, the problem may not be inside your eye. It may be coming from the edges of your eyelids, exactly where your eyelashes grow. Go to a mirror and look closely at the base of your eyelashes. Do you see tiny white or yellowish flakes? Do your eyelashes feel sticky when you wake up? Are the edges of your eyelids red, irritated, or slightly swollen? These can be signs of a common condition called blepharitis. The word may sound complicated, but the basic idea is simple. Blepharitis means inflammation of the eyelid margins. In other words, the skin and tiny oil glands around the roots of your eyelashes become irritated. This can make your eyes itch, but itching is not the only symptom. You may also feel burning, stinging, dryness, or the feeling that something is stuck in your eye. Some people describe it as having sand under their eyelids. Your eyes may also water more than usual. That sounds strange because we often connect watery eyes with too many tears, not dryness, but when the surface of the eye becomes dry or irritated, the eye may react by producing extra watery tears. These tears may run down your face without properly protecting the eye. Some people also notice that their vision becomes slightly blurry and then clears after blinking. This can happen when the tear film covering the eye becomes unstable. But why do the eyelids become inflamed? There is not just one possible cause. The oil glands along the eyelids may become blocked or may not release healthy oil. Bacteria around the eyelashes can also contribute to irritation. Skin conditions such as dandruff or rosacea may play a role as well. And then there is another possible cause that surprises many people. Demodex. Demodex are microscopic mites that can live in the hair follicles and oil glands of the skin, including the area around the eyelashes. You cannot normally see them just by looking in a mirror. That may sound frightening, but do not panic. Demodex mites are found on many adults and do not always cause a problem. The problem begins when there are too many of them or when they trigger inflammation around the eyelashes. One of the most important clues is a special type of buildup at the base of the lashes. It may look like a small white sleeve or collar wrapped around each eyelash. Eye doctors often call these collarettes. They may look like ordinary sleep crust, makeup residue, or dandruff. But if you clean them and they keep returning, especially together with itching and eyelid redness, Demodex blepharitis may be one possible explanation. However, do not look in the mirror and immediately decide that you definitely have mites. Allergies, dry eye, bacterial blepharitis, blocked oil glands, skin conditions, and even reactions to cosmetics can produce similar symptoms. An eye examination is needed to identify the real cause. So how can you tell whether your itching is more likely to be an allergy or an eyelid problem? There are 3 useful clues. First, think about where you feel the discomfort. With allergies, the itching is often intense and feels like it involves the whole eye. Both eyes are commonly affected. The eyes may look red and produce clear, watery tears. With blepharitis, the irritation may feel more focused around the eyelid edges and the roots of the eyelashes. Burning, stinging, crusting, and a gritty feeling may be be more noticeable than pure itching. Second, pay attention to what happens in the morning. Do your eyelids feel sticky when you wake up? Are your eyelashes difficult to open? Can you see flakes or crusts around the lash line? These findings make it important to examine the eyelids, not only the surface of the eyes. Third, look for other allergy symptoms. If your itchy eyes appear together with sneezing, a runny nose, and symptoms that become worse during a certain season, allergies may be more likely. But if the problem continues throughout the year and comes with recurring eyelid crusts, burning, or irritation along the lashes, the eyelids may be involved. Still, these clues cannot give you a definite diagnosis. A person can have allergies, dry eye, and blepharitis at the same time. One condition may even make the others feel worse. This is why repeatedly using random eye drops can become a problem. An allergy drop may temporarily reduce itching, but it will not clean blocked oil glands or treat every cause of eyelid inflammation. Artificial tears may reduce dryness, but they may not solve a Demodex problem. Antibiotic drops also do not treat every type of blepharitis. Never use an old prescription drop simply because it helped you or someone else in the past. This is especially important with steroid eye drops. Steroids can be very useful for certain eye conditions when prescribed and monitored by an eye doctor, but incorrect or prolonged use can cause serious problems, including increased eye pressure, infection, and cataracts. Another common mistake is rubbing the eyes. Rubbing can feel good for a few seconds, but it often makes the irritation worse. The more you rub, the more the eyelids and eye surface become irritated. Then the eye starts itching again and you rub it again. It becomes a cycle. Try to avoid rubbing, even when the urge is strong. A clean, cool compress may feel soothing when itching is related to allergies. For some forms of blepharitis, an eye care professional may recommend a warm compress to help soften crusts and improve the flow of oil from the eyelid glands, but temperature and treatment should match the actual problem. Something that helps blocked oil glands may not be enough for Demodex or another condition. Regular eyelid hygiene is often an important part of controlling blepharitis. This means gently cleaning the eyelid margins with a product and method recommended by an eye care professional. It does not mean scrubbing the eyes aggressively. Do not put vinegar, alcohol, essential oils, household soap, or homemade mixtures around your eyes. Some online remedies can burn the delicate skin, damage the surface of the eye, or make inflammation worse. Natural does not automatically mean safe, especially near the eyes. If you wear eye makeup, remove it completely before sleeping. Old or contaminated eye makeup may also irritate the eyelids. If a particular cosmetic repeatedly causes redness or itching, stop using it and discuss the reaction with an eye care professional. If you wear contact lenses and develop significant redness, pain, discharge, or light sensitivity, remove the lenses and seek professional advice. Do not continue wearing them while hoping the problem will disappear, because contact lens related infections can become serious. Blepharitis is often a long-term condition. It may improve and then return. That does not necessarily mean that treatment has failed. In many cases, controlling it requires consistent eyelid care and treatment of the underlying cause. If Demodex is the cause, your eye doctor may recommend a treatment specifically designed to reduce the mites. If the oil glands are blocked, the treatment may focus on improving their function. If bacteria, allergies, dry eye, rosacea, or another skin condition is contributing, the plan may be different. That is why one treatment cannot solve every itchy eye problem. Make an appointment if the itching keeps returning, if the crusts come back after cleaning, if your eyelids remain red or swollen, or if over-the-counter allergy drops do not help. A doctor can examine the lash line under magnification and look for the signs that are difficult to see at home. And there are some symptoms you should never ignore. Seek prompt medical care if you develop severe eye pain, a sudden change in vision, strong sensitivity to light, a very red eye, an eye injury, or thick discharge. These symptoms may point to something more serious than ordinary allergy or blepharitis. So the next time your eyes begin to itch, do not automatically blame allergies. Move closer to the mirror, look beyond the redness, and check the roots of your eyelashes. The answer you have been searching for may have been sitting right at the edge of your eyelids. Do you notice recurring flakes around your eyelashes, or does your itching only appear during allergy season? Share what you experience in the comments, because the difference may be more important than you think.